All right, take a look at this map. Do you live near where there is a measles outbreak? It has topped 600 cases now across 23 states, including the first case just reported out in Hawaii. Most of the cases are in Texas, though, where 2 unvaccinated children have died from measles-related illnesses. Health and Human Services Secretary Robert F. Kennedy Jr. has faced scrutiny over his comments on vaccines in the past. But you'll want to listen to this because in an exclusive sit-down interview with CBS News' chief medical correspondent, Dr. Jon LaPook, he encouraged people to get the measles vaccine. Listen.
It's one thing to say the measles vaccine is the best way of preventing spread, but it's another thing to then say, and therefore, we suggest that you get the measles vaccine.
We encourage people to get the measles vaccine.
Okay, so that, I think that's actually the next step, and that's news as far as I'm concerned, that you're saying that. What's the position philosophically of the federal government in terms of public health?
The federal government's position, my position is people should get the measles vaccine, but the government should not be mandating.
Understand,
no,
but
I've always said during my campaign and every public statement I've made, I'm not going to take people's vaccines away from them. What I'm going to do is make sure that we have good science so that people can make an informed choice.
All right, there it is. CBS News medical contributor Dr. Céline Gounder joins us now here in Studio 55. She's also the editor-at-large for public health at KFF Health News. Welcome to the studio. Your first time here.
My first time here.
Welcome. Warm welcome to you. So what we just heard there may have been confusing to some people, though. There has been a bit of a mixed messaging coming from RFK Jr. What might prevent the measles spread that we're seeing across the country now?
To be very clear, the number 1, number 2, number 3 things we need to be doing are vaccinating kids and others who have not been vaccinated against measles. That is the only way to prevent measles transmission. And once somebody is sick with measles, there are limited things we can do, largely ICU kinds of supports, in order to help someone through that illness.
Now, what's also interesting in this interview with Dr. Jon LaPook, there's been this concern about mass cuts that you and I have talked about over the past few weeks to all of the different federal agencies, including HHS. Let's listen to what was said about that.
You propose more than $11 billion in cuts to local and state programs addressing things like infectious disease, mental health, addiction, and childhood vaccination. Did you personally approve those cuts?
There's a number of studies that were cut that came to our attention and that did not deserve to be cut, and we reinstated them. Our purpose is not to reduce any level of scientific research that's important.
The secretary also said there were certain cuts he wasn't aware of when he was pressed by CBS News on specifics. But help us understand how these funding cuts affect people at home when it comes to disease prevention.
And I think it's very confusing because there have been so many cuts across HHS, NIH, CDC, FDA, et cetera. So it's a little hard to keep track of what's what. Even the secretary isn't really clear on what's been cut. So what we're referring to here specifically is the $11.4 billion in funding from the CDC to state and local health departments. These were not DEI cuts. These were, in fact, DOGE cuts that were related to the idea of the pandemic being over. But these public health departments are so underfunded that these COVID funds are being used for numerous different public health activities, including the kind of work that you would need to be doing to control a measles outbreak. So people, health workers going out in the field, testing people, informing people about what's happening, vaccinating folks, wastewater surveillance to find out where the measles virus is moving, because that could help you figure out where to target your vaccination efforts next. Those are the kinds of things that are also being unfunded, defunded.
And as you had mentioned previously, it's the testing and the research before there's a crisis that helps us when there is a pandemic or something breaks out. Dr. Gounder, great to chat with you. Thanks so much.